I think it is an amazing thought with this window of opportunities, having a 5 years window now where we can actually do a real change. And then obviously, of course, it is related to the willingness of the donors. And I'm very happy to present one of the representatives of the donors. Mr. Lennarth Hjelmåker is the ambassador of global health here in Sweden. And welcome. We're happy to hear what you say. Will Sweden be able to maintain the role we've had so far in funding?
So thank you, MSF, for inviting me to this very important seminar. And I must say I'm not only glad and happy, I'm honored to be here today. And we also very much appreciate the good and close cooperation with MSF and many of other of you here in the room. Yes, I just came back from Tanzania, where I was the Swedish ambassador for 5 years. But it was not in Tanzania, it was actually in Africa. I met in Kenya, I met HIV the first time, many years back. And that time it was a Swedish man. And he came up to my office one day and he said, Lennarth, I'm going for a funeral in the US because a former partner of me have died from something. And they didn't even know the name of that illness. And that was in the early 80s. So it was very early. But since then, HIV has become something very important for me and something I very often come back to and so on. I've also worked for a number of years in New York in our UN mission, and during that time Sweden was very much behind the establishment of UN AIDS, where we saw how the UN system did not work and we needed something more to work better on HIV. Back to Africa again, Tanzania, and now I'm back in Sweden, back in the sector again, as an ambassador for global health. And I'm succeeding Anders Nordström, that I know many of you know. And in this capacity, I'm very much engaged on the board of UN AIDS, on the Global Fund, but also other organizations. Words to deeds, policies, strategies, and commitments. I was actually sitting yesterday afternoon and put a number of small notes together and headings, and Tobias and Kerstin, you have already touched upon a lot of this, so I will jump a little bit around. But words into deeds, I think this is strategic and very important. It's very relevant, from rhetoric to action. This is something I strongly believe in, to move words into deeds, to make policies, strategies, statements and commitments becoming reality in people's real life. And this being said, I strongly believe in policies and strategies. I believe in commitments. I believe in documents, because those who sign up to these documents, those are the ones we can keep to stay accountable to what they have promised. So this link about policies, strategies, commitments, but also to follow up on what has been promised. A lot has happened. When I have taken part the last weeks in board meetings of UN AIDS and the Global Fund, but also listening to the two of you today, it is fantastic to see how much that has happened. 15 million people on treatment today. I remember the debate when I became the HIV and AIDS ambassador in 2003, and when WHO launched the initiative 3x5, how many doctors who said this is not possible, and how many activists that said this is too little. So, but we saw how important that initiative was, and today we see that we are far beyond that 3x5. We have 15 million people on treatment, but still reminding us about that this is not good enough. We need more people on treatment, and we need many more people to be targets for prevention. We must halt the spread. We see more than 2 million new infections every year. Very important that we remember to celebrate or to be happy about what we have achieved, but also to see what are the needs for the future. I think the world leaders, you challenged me, moderator, about what Sweden will do. I will come to that a little bit. But we have seen how the world leaders have realized that something must be done. And I was very much part of the MDGs and the work on the MDGs, and we were happy about the 3 goals related to health. Now we see many more goals, and I very much agree with Tobias when you say that almost all of them are very relevant for health. And that is important, because I have met people the last months who say there's only 1 out of 17 goals related to health. And I say, please go back home and read the goals again and tell me what goals are not relevant for health. So this is important with the Sustainable Development Goals, and also the commitment in the goals, and leaving no one behind. And when I last night read the political declaration once again, and I see in that political declaration on Agenda 2030 that we embark on this great collective journey. We pledge that no one will be left behind. The world leaders met and they say we pledge that no one will be left behind. Let's keep them to stay accountable to that. Then we know that the agenda was operationalized in the 17 goals and also the 169 targets. And we have already heard about the target 3.3, goal number 3, target 3.3, that says that by 2030 end the epidemic of AIDS, tuberculosis, malaria and other communicable diseases. To end. In the previous goals we heard about to halt and to reverse, and we heard directions. Here we hear a very good word, to end. I think that is a very important way there. Following the SDGs, we have been agreeing to strategies in the UN AIDS and in the Global Fund, very forceful strategies. And I did find it so exciting to be at the UN AIDS board meeting, the first agency, the first organization, the first joint program that met after the SDGs, and to see how it was so clear by all member states that this is something we have to move forward on. When I became the AIDS ambassador in 2003, we still discussed quite a lot prevention or treatment. And I remembered a little bit about old times in development when we talked about aid or trade and aid, or aid for trade, and different combinations. And I felt there was a little bit the same discussion here about prevention or treatment. But when I read and when I listen to Michel CDB when he opened the UN AIDS board meeting, and I will quote him here when he said treatment and prevention go hand in hand. Their combined impact is enormous and is changing lives for better. But still, life-saving medicines are not reaching a large segment of the world's people, and the future of the AIDS response will depend on whether the world can act together to reduce the number of new infections. So this very clear message on working together. Not so much. A little bit has been said about human rights. I will use a few minutes to say that. I have my watch here. We were a little bit late when I started. The fight against HIV and AIDS clearly show the necessity to secure the full respect for all human rights. And I'm reading from my script here because I think this is important. All human rights for all people. This is relevant for women and men, boys and girls. There should be no limitation based on gender, on sexual orientation, or any other aspect of life. The right not to be subject to stigma and discrimination is crucial. The president of MSF, there, thank you for opening the meeting today. You touched upon that, stigma and discrimination. The right not to be subject to stigma and discrimination is crucial. And there must be an end to sexual violence, of course. So the full respect for all human rights also means to reach the young people, in particular young girls, that we know are more exposed to HIV than young boys. We know that 71% of new infections in sub-Saharan Africa are among adolescent girls. And also special efforts must be made to address gender inequalities and discrimination among young women and girls. But this is not only about women and girls. And very often when I talk about this, I'm one of the few who talk about the boys and the men, that both beliefs and behavior of very many boys and men must change. So we must also, I would say, empower the boys and men to dare to change. But in all, the overall on what I touched upon on human rights, we talk about key populations very often. Tobias, you talked about men have sex with men, you talked about injecting drug users, about men and women who sell and buy sex, and so on. I mean, these key populations must be reached, must be seen, their voices must be heard, they must be part of the overall fight against the pandemic. Now I am on my last page. The UN AIDS strategy, coming back to that one again, and even if I talked so much about treatment and prevention go hand in hand, the UN AIDS strategy is a lot about prevention, how to halt the spread of the infection, how to stop the 2 million new infections per year. The message is clear. There is a need to instill new energy in HIV prevention. What I also, in very short, would like to say here is that we must, based on priorities, based on evidence, and on context. Context, very important. Accelerate or crash, UN AIDS talk a lot about. The 5 years of the window of opportunity you talked about. I don't need to spend a lot of time on that. I also believe it's a crucial point in time right now to see how to handle it for the coming 5 years. Finally, all actors are needed. Act as one. I see Pia here, Pia Engström from SIDA. You will talk later on today. I see Lotta Roos also from SIDA, maybe others. We did produce a small script some years back. All actors are needed, but we need to act as one. We need all actors, big and small, international, national, private, public. But we must go in the same direction. We must believe in evidence and all that. So all actors are needed. And then it comes to who will pay. Kerstin, you are a good activist. Thank you for reminding us about the needs, about what is needed. And thank you both of you for commenting upon domestic responsibilities, because that is also important. Because when we talk about who will pay, it is about both national and international. It is about small and big. It is about business. I think we should see much more coming from the private sector, from business. Sweden has been and will continue to be an important actor in this field. And I could have started by talking about the 850 million we dispersed to the Global Fund this year, the 200 million we dispersed for UN AIDS this year. But I didn't do that because, like Kerstin said, we are also embarking on a new process on replenishments, and we are looking into the future. So I'm sure you will continue to hear from Sweden also in that perspective. But let me also say that money is not all. Many of these things is about how to change. It's about dialogue, it's about advocacy, it's about how to deal with government, how to deal with other actors. And it is important to be able to combine this money part and the other part. And Sweden will continue to do that, and I will be part of that. So that was 16 minutes, and I had 15. I will stop here, but I will also say, once again say thank you to MSF for organizing this. Thank you to the president of MSF up there. When Mark Deipel, the head of Global Fund, was here, and Michelle Sideby, the head of UN AIDS, were here a month back. We met them in different fora, and our state secretary organized the lunch, and we were very happy that the president of MSF was there, and we had a good dialogue on that. 2 weeks ago, when I went to Geneva for the board meeting of the Global Fund, I met Kerstin all the time in the corridors, and you did your advocacy lobbyist work there. And I think I want to give credit not only to MSF, but to very many of you from civil society. You play an extremely important role. From the public side, we will also continue to play what we believe is an important role. Thank you.
Thank you. I think you can take the microphone with you, and let me see where your sign is, next to Tobias. And could I just ask you one very brief question before the next speaker comes? Because, as you mentioned, you used to be the ambassador for HIV/AIDS. Now you are the ambassador for global health. Does that indicate a change in focus from the government, or why? Or how should we interpret that?
Strengthen systems for health. That was one of my short points I didn't have the time to touch upon. Thank you for the question. No, already during the last years when I was the ambassador for HIV, I felt it was somewhat difficult to see upon one disease against another one. HIV, malaria, TB, diarrhea, whatever. I think we should be able to handle the global agenda and the health agenda in a broad sense. And to do that, I think we need stronger health systems. And so it's not a shift in policy, I would say, but it is something that we strongly believe in, and that I'm not a medical doctor like many of you. I'm a political scientist and economist, but I believe that it is important that we can look upon HIV as part of the broader health agenda. That does not mean that we don't look upon it as very, very, very important. I liked what Michel CDB said here, and I don't know if I should quote somebody he quoted and so on, but I liked when he said, when a former minister for health in an African country said, well, I was not really a minister for health, I was a minister for some public hospitals. So I think this about strength and systems for health is important, and the community level that already was talked about. Thank you.
Thank you. And